Hello everyone, welcome to part 3 of Anatomy of Larynx, and in this we are going to cover the ligaments and membranes of larynx. Those who haven't watched part 2 of larynx, it was about the cartilages of larynx, and I'll just give a quick recap. The cartilages are two. One is the unpaired group and other is the paired group. I think you know what is unpaired and paired. So unpaired are thyroid, cricoid, and epiglottis, whereas paired are arytenoid, corniculate, and cuneiform. This is a most common viva question for UG people rather than PG candidates. Okay, and we will quickly discuss all these cartilages. So when we are talking about this thyroid cartilage, I hope you know this that it has a right lamella and a left lamella, okay, which meet in the midpoint, and this depression is called as a thyroid notch. It has a superior horn and an inferior horn and an oblique line that runs, which provides attachment to three muscles. The superior one is longer and narrower, whereas the inferior one is shorter and broader, and it articulates with the cricoid cartilage, which is narrow anteriorly, okay, and broader posteriorly. And posteriorly it has two quadrangular lamellas where there is attachment of muscles. And cricoid also has two facets for articulation. One is for articulation of thyroid cartilage and other is the articulation of arytenoid cartilage. Arytenoid and cricoid is the only complete cartilage, okay. It is the only complete cartilage in signet shape, and arytenoid is pyramidal in shape. It has an apex and it has a base, and the joint is synovial joint, and it has two processes. One is the vocal process and the other one is the muscular process. Muscular process because muscles are attached, and vocal process because vocal is attached. And the last one which we talked about was epiglottis. Okay, now in this lecture we are going to talk about ligaments and membranes, as well as I'm going to cover spaces of larynx. Okay, now spaces of larynx is most important for PG, not for UG, because my university question for almost 20 marks was to talk about the ligaments and spaces of larynx. So it is quite in detail, which we are going to discuss. Okay, so again, the ligaments of larynx are divided into two. Okay, first intrinsic, and then we have the extrinsic. Intrinsic and extrinsic. What is the difference? Okay, intrinsic connects larynx with itself, whereas extrinsic, it connects larynx with the external structures. Okay, let's quickly look at this image which I showed you in the starting itself. Now see, epiglottis is a part of larynx. We know, okay. Thyroid cartilage is a part of larynx and cricoid is a part of larynx. Okay, so any ligaments connecting cricoid with thyroid, thyroid with epiglottis, okay, these are intrinsic ligaments. Okay, but any ligaments that are connecting thyroid with hyoid, because hyoid is not a part of larynx, whereas this trachea is not a part of larynx. Okay, so any ligaments that are connecting this thyroid with hyoid or cricoid with trachea are extrinsic ligaments. Okay, I hope this is clear, and it's quite easy to understand in this way. Okay, so now what are the intrinsic ligaments and what are the extrinsic ligaments? So we'll just go through the names, we'll go in detail. Okay, first is the vestibular ligament, and second is the vocal ligament, and extrinsic we have thyrohyoid ligament and cricotracheal ligament. Okay, ligaments are very easy because most of the things are in the name itself. Okay, so first we are going to talk about the extrinsic ligaments. Extrinsic ligaments are what connects cartilage with either hyoid bone or the trachea. Easy? Yes. So first is thyrohyoid. What is thyrohyoid? It is connecting the thyroid, okay, with the hyoid bone. Okay, easy. It is connecting with the thyroid and the hyoid. Now it is divided into two. Okay, it is further divided into two. This center portion, okay, this center portion is called as the median thyrohyoid ligament, whereas the lateral means what? The superior cornua which we talked about, right? The superior cornua the ligament is called as lateral thyrohyoid ligament. Easy. Okay. So the thyrohyoid ligament is connecting the thyroid with the hyoid. Okay. And it is further divided into two, the median and the lateral. The center portion is the median one, and the lateral, that is from the superior conva, it is attaching to the hyoid bone, is the lateral thyrohyoid ligament. Okay. And there is a nerve that is passing through here. Okay. The yellowish thing which are highlighted is the nerve. And which nerve it is? This is a PG Viva question, okay, because we give a superior laryngeal nerve block over here, okay, obviously the superior laryngeal nerve, the internal branch of superior laryngeal nerve as well as the superior laryngeal vessels, they pass through the median portion, okay. So whenever we need to give a superior laryngeal nerve block, so we give it over here, okay, near the thyroid notch. Clear? This is a PG Viva question, or they can ask you in any kind of MCQs. Next is the cricotracheal ligament. So this is also easy. So you have your cricoid over here and you have the tracheal rings over here. Okay. So cricoid to trachea is nothing but this is the cricoid. Okay. And this is the tracheal rings is nothing but the cricotracheal ligament. Okay. So the third one is the hypoepiglottic ligament. So the hypoepiglottic ligament is the one in which the epiglottis is connected with the hyoid bone. Okay, this is nothing but the hypoepiglottic ligament. Now we'll talk about the intrinsic ligaments. The intrinsic ligaments are two in number. One is the quadrangular membrane and the next one is the conus elasticus. Okay, I want you to focus on this section over here. It is like a lateral section. Okay, this is the hyoid bone. Okay, as you can see, this is the thyroid and this is the thyrohyoid membrane basically. Okay, and this is the epiglottis. Okay, so when we are talking about this quadrangular membrane, so it is extending from the upper border of the epiglottis and the arytenoids, as you can see, and inferiorly it forms the false vocal cord. You can see I have highlighted over here the false vocal cord. So it is coming from upwards to down like this. Okay, it is covering like a drape and it is quadrangular in shape, and inferiorly it is forming the false vocal cords. Whereas when we talk about conus elasticus, it is extending from below upwards, मतलब नीचे से ऊपर जा रहा है. तो नीचे कहाँ से ऊपर जाएगा? From the upper border of cricoid. ये दिख रहा है? This is a cricoid, okay, and this is this brownish shade which I have given, that is nothing but conus elasticus. Okay, from cricoid it is extending upwards, okay, till the thyroid cartilage prominence, and then it goes to the vocal process of the arytenoids. Okay, it is reaching up to here, and then it is forming a layer. Okay, then it is forming a ligament. It is also called as ligaments. These are also called as membranes. It is like whatever you want to call it. Now there is a space between these true vocal cords and the false vocal cords. I want you to focus on this diagram. Okay, the blackish shade which I have given over here, the blackish shade which I have given over here, that is ventricle. It is nothing but the space between the false and the true vocal cords is the ventricle, and as you can see, extending upwards, it leads to a space which is called as this saccule, and this saccule contains mixed mucinous glands that lubricates the vocal cord. This is very, very, very important, and this is an Viva question for PG or UG candidates. Okay, this is one space. Okay, you can call it as a ventricle or you can also call it a saccule, whatever you want. This is one space that is done. Now the next space is paraglottic space. Okay, so it is very difficult to understand, but still I am trying my best. Okay, I just want you to focus over here. So you see there is a false vocal cord. We know there is a false vocal cord and we know there is a true vocal cord. And this one, this is nothing but the thyroid cartilage. Okay, and these are nothing but the vocal areas. Now this orangish area which is there, that is nothing but the second space which we are talking about, that is the paraglottic space. Okay. Now in this diagram also you can see this is the thyroid cartilage. and here you have the false vocal cord and the true vocal cord. So this is the paraglottic space. Above you can see pre-epiglottic space, which we'll discuss in a moment. Okay. So when we are talking about the boundaries of the paraglottic space, so laterally. So what is laterally? You can see we talked about that is nothing but the thyroid cartilage, right? So perichondrium of the thyroid cartilage and the cricothyroid membrane. So this is the cricoid. You can see this is the cricoid, or the membrane that is connecting the cricoid and the thyroid is nothing but the cricothyroid membrane. So laterally, you have two things. One is the perichondrium of the thyroid cartilage and the cricothyroid membrane. And posteriorly, what you have the mucous membrane of the pyriform sinus. You cannot appreciate in the diagram. You need to visualize it. And anterosuperiorly, you have seen the anterosuperiorly, you have the pre-epiglottic space. I'll just remove this so you can just check the whole diagram out. You can get a good orientation of the diagram, because the diagrams are quite difficult to find and quite difficult to understand. So I want a clean picture for you. Okay, I hope you understand this. That is the paraglottic space. Now we'll talk about the pre-epiglottic space. Okay, pre-epiglottic space. Now this is the hyoid bone and this is the epiglottis. Okay, and this is the thyrohyoid membrane. Now the area, okay, this yellowish area which I have shaded, that is nothing but the pre-epiglottic space. Okay, the yellowish area. Now you can correlate with the boundaries. Anteriorly you have the thyrohyoid membrane, right? Posteriorly you have the epiglottis, right? Superiorly you have the hyoid bone, right? Inferiorly we have the petiole of epiglottis and thyroepiglottic ligament, and laterally you have the paraglottic space. This diagram is quite good because you can get most of the relations from this diagram. So this is nothing but the third space which we talked about is the pre-epiglottic space. So in this lecture we have covered about the ligaments and the spaces of larynx.